Assalamualaikum warahmatullahi wabarakatuh. My name is Nanik Wahyuningsih. I am studying Islamic Psikologi class 2C. I am here to present the results of my work. Mental health response to the COVID-19 pandemic in Kenya. A review. Background. The COVID-19 pandemic has exerted considerable impact on public mental health globally, with the pandemic rapidly rising in sub-Saharan Africa, including Kenya. There is need to provide evidence to guide the mental health response in the region. The objective of this review is number 1, to describe the mental health response to the COVID-19 pandemic in Kenya, guided by the mental health preparedness and action from work. Number 2, to after context specific recommendation for improvement of the mental health response in Kenya. Such information could be useful in the decision making in Kenya as well as in the greater sub-Saharan African region. Method. This narrative review is based on information obtained from official government documents released from 13 March 2020, the beginning of the pandemic in Kenya, up to 31 July 2020. Discussion. The COVID-19 response in Kenya has no formal mental health response plan. There is an unmet need for psychological first aid in the community, while guidelines for the management of mental health conditions during the COVID-19 pandemic have been prepared. Implementation remains a major challenge due to a poorly resolved mental health system. There is no mental health surveillance system in place, limiting ability to design evidence-based intervention. Keywords: COVID-19 mental health response Kenya, sub-Saharan Africa. Sustainability of mental health care service. Direct funding to the mental health response could not be ascertained, given the lack of a formal mental health response plan. It is likely that funding for the mental health response is erratic and inadequate. Post-pandemic period. In the post-pandemic period, Kenya should conduct a thorough evaluation of the 5 components of a mental health response as outlined in the MHPEF. Lessons learned should be utilized in preparing a well-coordinated mental health response plan specific for pandemic situation. Conclusions and recommendations. Kenya has made attempts at instituting a mental health response to the COVID-19 pandemic despite underlying system challenges. However, major gaps remain. We therefore propose 4 case strategies of strengthening the mental health response in Kenya. Number 1, preparation of a formal mental health response plan for COVID-19 by the Division of Mental Health with allocation of funding to the response. This ought to be prepared by a team of mental health experts and guided by the 5 components of the MHPEF. Number 2, training of community health workers and community health volunteers on psychological first aid. Number 3, scaling of scaling up of mobile health to increase access to mental health and psychological support for the general public during the pandemic. Number 4. In order to ensure proper surveillance of the mental health situation during the current pandemic, we propose the review system and large surveys are conducted to allow for monitoring of the mental health impact of COVID-19 in Kenya. Major mobile service providers in Kenya have survey platforms that use text message. This constitutes potential means through which mental health surveillance could be conducted. Thank you. Sekian. Wassalamualaikum warahmatullahi wabarakatuh.